Hey, what's going on? Dr. Caban here, and welcome back to my YouTube channel. For those of you that don't know me, I am a general surgeon and a bariatric surgeon in North Central Florida. And today we're going to be talking about smoking and bariatric surgery. I'm going to give you several reasons of why you need to quit smoking before surgery and why you don't want to go back to smoke after bariatric surgery. But before we get into that, we want to talk about a quick disclaimer. Remember that the intent of this video is for educational purposes only. It is not intended to diagnose or to treat any condition, and it is not intended to substitute a consultation with your physician or your surgeon. Watching this video does not create a doctor-patient relationship, and the expressions in this video are the expressions of myself, Dr. Caban only, and they do not reflect the expressions of my employer or any other entity. So now that we got that out of the way, let's go back to smoking and bariatric surgery. The first reason why I think it's important for you to quit smoking before bariatric surgery is your mindset. You know, many people that smoke believe that it's pretty close to impossible to quit smoking, and some patients have tried to quit smoking several times and they fail, or they quit smoking for a long period of time and then they went back to smoking. So I think if you can accomplish quitting smoking for at least 3 months before bariatric surgery, that's gonna put you in a different mindset when you're going into surgery. You're gonna be going into weight loss surgery, accomplishing a big victory, and all of a sudden you have a completely different mindset going into weight loss surgery, and you have a different attitude towards your next goal, which is losing the weight. So I think this change in mindset is a big factor of why you should quit smoking before bariatric surgery. Now, reason number 2 has to do with tissue healing. It's very well known that people that smoke have decreased tissue healing. That happens because the small blood vessels that carry the blood to the tissue that help us heal the tissues, sometimes in patients that are chronic smokers or they've been smoking for a long period of time, those small blood vessels called capillaries are occluded and the blood flow to the tissues decreases. Now, when we do weight loss surgery, or as a matter of fact any other type of surgery, we want as much tissue healing as we want, because that is going to prevent you from having complications like infections, hernias, or even a leak. You know, when we do a gastric bypass, we cut the stomach and we attach the small intestine to it. So trust me, we want as much wound healing in this area as we can get, so we can get adequate healing and decrease complications. So reason number 3 is other complications. We know that people that smoke have more complications of pneumonias or blood clots in their legs, and a blood clot in the leg that goes to the lung can actually kill the patient postoperatively. Patients that are significantly overweight and go through surgery actually have a higher chance of having DVTs or blood clots in their legs. Plus, if you add the risk factor of smoking, that increases the chances significantly. So we want to minimize as many complications as we can get, and smoking is gonna definitely help in that regard. Now, reason number 4 is stomach ulcers. People that smoke are more prone in having stomach ulcers. Right now, if you're a smoker and you get a small stomach ulcer, you might not even notice that you have an ulcer, or you know, the body is gonna heal it pretty quick. But after bariatric surgery, that is gonna change because of the blood flow to the stomach. Now, I'm gonna do a quick diagram here for you in the iPad, and I'm gonna try to explain this to you a little bit better, and it's probably gonna make a little bit more sense. Okay, so this is your esophagus going into your stomach. Now, the stomach normally has 4 major blood vessels that drive blood into the stomach. And let's say you get a small ulcer in this area over here in the upper part of your stomach. Currently, because of the adequate blood flow to the stomach, most likely you're not even gonna know that you have that ulcer, and that ulcer is gonna heal very quickly. Now, after a sleeve gastrectomy, that is going to change, because we're going to divide your stomach like this. So now all of a sudden the stomach goes from having 4 major sources of blood flow to it to only 2 sources of blood flow to the stomach, decreasing the chances of that ulcer healing by 50%. That's a significant difference. Now, it still has adequate blood flow to it that it can probably heal. So this in a sleeve gastrectomy is not as significant, but that still doesn't mean that you should go back to smoking. I'm not saying that you should do that, but the effects are not as pronounced as if you had a gastric bypass. And when you have a gastric bypass, we're going to divide the stomach like this. We're going to create a small little pouch in the upper third of the stomach. And if you're smoking and you get an ulcer in that same spot, all of a sudden the ulcer has only 1 blood vessel to heal. Trust me, if you develop an ulcer from smoking after a Roux-en-Y gastric bypass, that ulcer is going to be very hard to heal if you don't quit smoking. Or a lot of patients will present to the emergency room with significant abdominal pain and a perforation from an ulcer and require an emergency surgery. And trust me, those surgeries, especially in the middle of the night, they're not fun at all. And it's not gonna be fun for you either. So I will strongly recommend that you do not smoke before the surgery, or you do not start smoking after the surgery, because you can definitely develop complications from smoking. So it's my recommendation that you quit smoking at least 3 months before bariatric surgery, and that after bariatric surgery you don't go back to smoking. So now to summarize, reason number 1 is your mindset. Again, if you quit smoking, you accomplish something very important, and now you're more mentally prepared, in my opinion, to go through bariatric surgery and change the next big thing in your life, which is your weight. The second one is tissue healing. We want as much tissue healing as we can get before bariatric surgery so we can minimize complications. The other ones are other complications related to smoking, like pneumonias or respiratory problems and DVTs or heart attacks or stroke. And last but not least, ulcers. You can develop ulcers if you start smoking after bariatric surgery, and trust me, that is gonna give you nothing but problems. If you like the content in this video, please subscribe to my channel. Also, if you like the video, give me a thumbs up. That really helps to get the channel going and get the information to other people. If you would like to have a consultation with me, feel free to call my office. The information is down below. If you're thinking about bariatric surgery but you don't know if you qualify for bariatric surgery, watch my previous video. I went into a little bit of detail of what you need to do. Again, thank you for your time. I really appreciate you spending some time with me today. And if you have any questions that I can answer for you in a video, feel free to put it in the comment as well. And I'll see you soon